Assalamualaikum warahmatullahi wabarakatuh. A lovely day I bid to Doctor and to all my fellow classmates. My name is Trisha binti Muhammad Nafia, and today I'll be presenting regarding organophosphate. Organophosphate is a type of cholinergic drug. A cholinergic drug is a drug that causes indirect acting towards our body. For example, increased production of acetylcholine will occur due to the drug inhibiting the enzyme acetylcholinesterase. Organophosphates are also known as phosphate esters. This is because it contains a general structure that have phosphate as the central, and it has multiple aromatic substituents around it. It is generally seen colorless to brown in room temperature. Organophosphates are used in various fields. For example, malathion is a type of organophosphate that is used in the medication field to treat head lice. Meanwhile, in the mid-1800s and in the early 1900s, organophosphate was used as chemical warfare, or also known as biological weapons, as it can interrupt the nerve agents in our body, or also known as neurotransmitters. Nowadays, organophosphates are widely used in the agriculture industries, as it falls in the class of insecticides due to its high toxicity. Insecticides are basically chemicals that act as poison to kill pests or insects such as wasps, to prevent them from going through with their infestic behaviors. But even though it is considered as a good insecticide and was widely used, many organophosphates have been discontinued, such as parathion. This is also because of its high toxicity. Unfortunately, the chemical's high toxicity leads to organophosphate poisoning. Majority of the patients who are infected are usually from the class of farmers. Which brings us to today's topic of organophosphate poisoning. Organophosphate poisoning can occur when there are high level of indigestion or high level of exposure through breathing of the compound. Poisoning occurs when there are accumulation or overstimulation of acetylcholine due to inhibition of acetylcholinesterase. Acetylcholine is the main neurotransmitter functioning in utilizing the parasympathetic nervous system of the autonomic nervous system, while acetylcholinesterase is an enzyme that functions in controlling the impulse or stimulation of acetylcholine to be transmitted from the nerve fibers towards the central nervous system. Inhibition of this enzyme will cause the acetylcholine to be out of control. Now, let's move on to the mechanism of organophosphate poisoning. First, when the organophosphate enters the patient's body, it will phosphorylate, which is adding phosphate, towards the hydroxy group of the acetylcholinesterase enzyme. This occurs at the active site of the acetylcholinesterase at the postsynaptic neuron of the muscle cell. Phosphorylation of acetylcholinesterase will cause inactivation of the enzyme. Inactivation of acetylcholinesterase will cause non-stop signal of acetylcholine at the synapse or nerve fibers. This will then lead to the accumulation of acetylcholine in the neuromuscular junction or in the muscle cells. The accumulation of acetylcholine will then lead to muscarinic or nicotinic symptoms. Moving on, let's talk about symptoms. Muscarinic symptoms caused by organophosphate poisoning are such as salivation, which is excessive production of saliva, lacrimation, which is the abnormal secretion of tears, frequent urination, defecation, and gastric cramps that can cause diarrhea. Symptoms also include emesis, which technically means vomiting. Meanwhile, nicotinic symptoms are such as muscle twitching, muscle weakness, and muscle cramps. This is since acetylcholine promotes dilation and contraction of muscles. Nicotinic symptoms also include tachycardia. Tachycardia is when the heartbeat rate per minute is very high or very fast. This will then lead to hypertension, which is high blood pressure, and miosis, which is the excessive constriction of pupils causing pinpoint pupils. Furthermore, symptoms seen in central nervous system (CNS) are such as increase in pulmonary secretion, which may lead to respiratory failure. Also, organophosphate symptoms regarding the central nervous system also involves behavioral disturbances such as confusion and anxiety. Before I proceed, as you can see, muscarinic symptoms and nicotinic symptoms are two different things. Why? This is because muscarinic symptoms are related to muscarinic receptors, while nicotinic symptoms are related to nicotinic receptors. Muscarinic receptors are basically receptors that are located at the visceral organs and glands, while nicotinic receptors are located at the cell membrane of skeletal muscle and cell membrane of ganglion nerves. Thus, the category of symptoms are different depending on where it affects. Now, let's move on to treatment and prevention of organophosphate poisoning. To overcome muscarinic symptoms of organophosphate poisoning, patients are usually prescribed with atropine, such as atropine sulfate. This is because atropine can function as a non-specific antagonist. This means atropine will function in blocking all muscarinic receptor subtypes, preventing the binding of acetylcholine to an active site, thus preventing the activation of the receptor. Next, to overcome nicotinic symptoms of the organophosphate poisoning, patients are usually prescribed with pralidoxime. Pralidoxime can function in activating phosphorylated acetylcholinesterase by letting it bind back to the organophosphate. But the medication must be taken before 48 hours of poisoning, and it also does not necessarily help with respiratory symptoms. What about the test? How do we confirm that a patient has actually undergone organophosphate poisoning? Well, to confirm organophosphate poisoning, blood samples of the patient are taken and analyzed. This is done to measure the acetylcholinesterase enzyme levels in the red blood cells and also the plasma pseudocholinesterase in the blood. If both of those two levels decreases drastically, it will give us a confirmation on the organophosphate toxicity. Because both measurement of acetylcholinesterase levels in the blood and pseudocholinesterase plasma levels can indicate the enzymatic activity in the body, thus showing us the rate of exhaustion of organophosphate in the body, enabling us to confirm the organophosphate poisoning of the patient. Conclusion. In conclusion, organophosphate poisoning by inhalation and indigestion of the chemical is due to inhibition of acetylcholinesterase enzyme, leading to accumulation of acetylcholine. This will then lead to muscarinic and nicotinic symptoms. Treatments involve atropine and pralidoxime. It is advised that precautions such as personal protective equipment and avoiding direct contact with exposed clothing are taken seriously to prevent any organophosphate poisoning in the future. That is all from me. Thank you for your attention. Goodbye.